Good afternoon, Nighthawk Nation. Today we're going to cover some of Module 3 and the government's role in U.S. healthcare. And to keep in mind that there are four major learning objectives from this module that also tie into your course objectives. Those learning objectives are going to be, you'll be able to describe 5 U.S. governmental organizations and their roles in healthcare, to be able to analyze the integration of the collaboration of the Department of Homeland Security and the Federal Emergency Management Agency, and it's important to disaster management. You'll also should be able to discuss the regulatory responsibility in healthcare of the U.S. Food and Drug Administration, as well as you should be able to evaluate the role of Centers for Medicare and Medicaid Services in healthcare. Now, keep in mind with the government organizational's role in healthcare, during the Depression and World War II, the United States had no funds to start a universal health care program. And this had been an issue that had been discussed for years. So they came up with the passage of the Social Security Act of 1935, and then the establishment of Medicaid and Medicare programs in 1965, which that mandated the government's increased role in providing health care to those who did not, healthcare coverage for those who did not have it. The Affordable Care Act took it a step further, and it developed several government programs which increased the ability of individuals to make informed decisions about their health care and increase access to health care. Things such as you couldn't be turned down because of a pre-existing illness. You couldn't be turned down for health coverage because of your financial status, things of that nature. And keep in mind that social regulation focuses on actions such as those in the healthcare industry that impact an individual's safety or well-being. The regulatory healthcare power is shared among several federal and state government and local health government, with local health governments providing a majority of those direct services. Now, when we discuss healthcare and the roles of healthcare with the United States government, probably the most important federal agency with regard to healthcare is the U.S. Department of Health and Human Services. This is a federal agency that's at the cabinet level or executive branch of the federal government. It has 11 operating divisions, and it collaborates with state and local government levels because many of their activities that actually operate on a more local level, even though they're federally covered and mandated. Now, the Surgeon General, who is in charge or is the nation's chief health educator, is in charge of the nation's healthcare. The Surgeon General provides information on how to improve the health of the U.S. population and is appointed by the President. The Office of the Surgeon General oversees the operations of the commissioned U.S. Public Health Corps, and the U.S. Public Health Service Commission Corps consists of approximately 6,500 public health professionals who are stationed within federal agencies and programs. They played a major role in educating the public about COVID-19 during the pandemic. So the importance of the U.S. Surgeon General cannot be understated. Several programs that we're going to discuss. We'll start with the Department of Homeland Security and the Federal Emergency Management Agency, better known as FEMA. You see the two websites here, DHS.gov and FEMA.gov. The Department of Homeland Security was established in 2002 after the 2001 terrorist attack on the United States. It combined 22 different federal departments to form the Department of Homeland Security. FEMA, which is responsible for the management of catastrophic events, was integrated into the Department of Homeland Security in 2003. They are responsible for coordinating efforts at all government levels to ensure emergency preparedness for any catastrophic events such as bioterrorism, hurricanes, Hurricane Katrina. FEMA was one of the major government organizations to step in and aid as much as they possibly could. And so keep in mind that is the role of FEMA. We're going to cover several government programs and departments that are vital when it comes to the roles of the U.S. government in healthcare. The biggest one is the Center for Disease Control. The CDC was established in 1946. It's headquartered in Atlanta, Georgia. And the main mission for the CDC is to protect the health and promote quality of life through prevention and control of disease, injury, and disability. The CDC's main goal is public health, and it played a huge role in the pandemic regarding health policy, vaccine schedules, mask wearing, things of that nature within our country. A second organization is the Office of Assistant Secretary for Preparedness and Response, better known as ASPR. ASPR was created under the Pandemic and All Hazards Preparedness Act in the wake of Hurricane Katrina. This was done to prevent, prepare for, and respond to adverse health effects of public health emergencies and disasters. It mainly focuses on preparedness, planning, and response, the building of a federal emergency and medical operation capability, and countermeasures, research, advancement, development, and procurement. It grants to strengthen hospitals and the healthcare systems in the public health emergencies and medical disasters. The biggest takeaway or the biggest thing to think about with ASPR is they are planning ahead for disasters and have programs in place. The Administration for Community Living, established in 2012, better known as the ACL, it is responsible for increasing access to community supports while focusing attention and resources on the unique needs of the older Americans and people with disabilities across lifespan. The ACL plays a major role in aiding individuals to age in home, to live at home, and to have a greater access to the health care and needs to sustain life at home without the assistance of long-term care facilities. The Agency for Toxic Substances and Disease Registry. This is the lead federal public health agency responsible for determining human health effects associated with toxic exposures, preventing continued exposures, and mitigating associated human health risk. The Agency for Toxic Substance Abuses and Disease Registry is administrated organizationally, if I can speak today, through the CDC. So the CDC plays a major role in this. Some other institutes, one that you've more than likely heard through the pandemic and was a major focal point is the National Institutes of Health. The NIH is the primary federal agency for research towards preventing and curing disease worldwide, not just within the confines of the United States, but the NIH looks outside that and it looks to prevent disease worldwide. It currently has 22 institutes and centers that focus on different diseases and conditions, including things such as cancer, heart and lung disease, aging, alcoholism, substance abuse, children's diseases, mental health. It's got a pretty broad scope when it comes to looking at various illnesses and disease and methods and things that we can do to get ahead and to cure. The next one is the Health Resources and Service Administration, the primary federal agency for improving access to healthcare services for people in every state who are uninsured, isolated, or medically vulnerable. Tens of millions of Americans get affordable health care and other help through HRSA's 100-plus program and more than 3,000 grantees, which is it's a fantastic program. Definitely worth going on to the website and checking that out. Next, we have the Indian Health Services. And the Indian Health Services mission is to raise physical, mental, social, and spiritual health of American Indians and Alaska Natives to the highest level. It ensures that comprehensive, culturally acceptable health services are available and accessible to these populations. It also provides a comprehensive health service delivery system for approximately 1.9 million American Indians and Alaska Natives who belong to almost 600 federally recognized tribes. They have a fantastic health program. I had the opportunity to visit a reservation and speak to some of the healthcare providers and people within the healthcare network of the Indian health services programs, and they have a fantastic. They're light years ahead of the rest of the country when it comes to healthcare services. So this is one I would definitely go on, check out, and maybe and see what you think we could institute or incorporate into our current medical system. SAMHSA, the Substance Abuse and Mental Health Service Administration. For those of you who are going to go into counseling, substance abuse counseling, substance abuse disorder, rehabilitation, this is a program or an organization that will play a major role in your career. The main federal agency for approving access to quality substance abuse and mental health services in the United States. It works with state, community, and private organizations, and it's an absolutely fantastic program. A couple of more we'll cover real fast. The U.S. Food and Drug Administration, the FDA, is responsible for ensuring that all following products are safe, such as food, human and veterinary products, biological products, medical devices, cosmetics, electronics, anything and all responsible for, also responsible for ensuring that consumer product information is accurate, that advances in public health by speeding up innovations to make medicine and food more effective, safer, and more affordable. The FDA played a major role in the COVID-19 vaccines as they worked hand in hand with the companies getting these quick and fast approvals to get the vaccines out. Another administration that you'll need to know, Administration for Children and Families. The ACF is responsible for federal programs that promote the economic and social well-being of families, children, individuals, and communities. There's currently 10 regional offices throughout the United States. The biggest one, and we'll cover this again throughout the semester, is Centers for Medicare and Medicaid Services. The CMS was established when Medicare and Medicaid programs were signed into law in 1965 by President Lyndon B. Johnson, and as a result of the Social Security Act. It has currently over 20 offices that oversee different aspects of the program. The primary responsibility is to provide policy, funding, and oversight to healthcare programs that serve the elderly and the poor. As a part of the Affordable Care Act, it works hand in hand, Medicare and Medicaid services, and they were even expanded, the services, during the Affordable Care Act. So OSHA, for anyone that is working currently, anyone who's going to own a business should be and needs to be very familiar with OSHA, the Occupational Safety and Health Administration. OSHA was established to govern a workplace environment to ensure that employees have a safe and healthy environment. It's played a huge role in ensuring that employers had safe workplaces during the pandemic. They also play a major role in making sure that if you work with around chemicals, you'll see eye wash stations, you'll see face and hand wash stations. These were put into effect because of OSHA. And so OSHA is a fantastic program that has prevented many, many injuries and deaths over the years. Can't say enough about OSHA and what OSHA means in the workplace. So let's talk about the state health department's role in healthcare. Some of the big things or takeaways is that it monitors communities to identify health problems. And so anytime we see the spread of disease, illness, anything within a community, a state health department is mandated to jump in and start overseeing and looking at what the cause is. The state health department role is also to develop policies to help support community health, enforce laws and regulations to promote health and safety, and is responsible for or shares responsibility for federal programs related to maternal and infant health services and cancer prevention. These are major items provided through the state health department's role in healthcare. They also collect health statistics and is the licensing agency in every state for healthcare professionals and healthcare facilities. That once a professional or facility is licensed, they then oversee to make sure that they're maintaining the proper education, the proper standards to maintain those licenses to protect the stakeholders at large. On a more local level, local health departments, typically 90% of immunizations and healthcare provided on a local level falls to local health departments when it comes to healthcare. Over 90% of communicable infectious disease surveillance takes place at the local level. Over 80% of TB or tuberculosis screening takes place on the local level through your local health department, as well as over 75% of environmental surveillance. So you'll see these surveillances, you'll see treatments, things of that nature taking place at the local level. Once it reaches a certain threshold, that's when the federal level is called in. Approximately 70% offer population nutritional services, whether that's nutrition education or the actual providing of food. School and daycare center inspections are currently handled by 75 to 80% of the local health department. And the State Department is going to cover that other 20 to 25%. We rarely see a federal agency come in and look into as far as inspections of school or center daycare. Those are going to be handled state level. 75%, almost 80% provide food safety education on the local level. And there are currently close to 3,000 local health departments across the United States. So they play a very prominent role in healthcare within, as far as government healthcare is concerned. And just in conclusion, the federal government plays an important role in the quality of U.S. healthcare system, and it provides the funding for state and local government programs as a whole. Federal healthcare regulations are implemented and enforced at the state and local levels, as well as funding is primarily distributed from the federal government to the state governments, which consequently allocates funding and trickles down to the local health departments. Local health departments provide a majority of the services for their constituents, such as school daycare, inspections, nutritional services, vaccinations, things of that nature. More local health departments are working with local organizations such as schools and physicians to increase the ability to provide education and prevention services. We're seeing more and more local health departments come into schools to do training and teach not only the students, the teachers, and the parents as well. And with that is going to be it for Module 3. A lot of this is covered through the PowerPoints that were provided in Module 3, as well as your readings. These are all things that you're going to carry forward with you throughout this program and throughout this semester and in future courses. So with that being said, I'm going to sign off. If you have any questions, please reach out and let me know. Other than that, have a fantastic Nighthawk day. Let's go Nighthawks.